As we continue to fight to prevent COVID-19 infections, especially in children, Moderna is now asking for emergency use authorization for its vaccine for kids under the age of 5. For more on what this could mean for parents, we're joined by Dr. Joe McBride, an infectious disease physician from UW Health Kids. Dr. McBride, thank you for joining us this morning.
Good morning. Thank you for having me.
Of course. So how close are we to seeing this vaccine for the youngest kids and when they're going to be able to get it?
I still think we're a couple months away at the minimum. And I'm really sympathetic to a lot of families in this 0 to 5 age group who've been waiting very patiently for a long time for vaccines for their children. This age group does not have the same kind of options for treatment as other age groups do. Things like the pills that you hear about or different antibody treatments are not really available. So getting a safe and effective vaccine to that 0 to 5 year will be really important to help families prevent severe infections and bad outcomes.
And kids between the age of 5 and 11, they can already get the vaccine, but we're not seeing a very high vaccination rate for them. Why is that?
Yeah, you're absolutely right. So school-age children have the ability to get a two-dose series of the vaccine, but are not yet eligible for boosters. I think a lot of families and people look at the severity of COVID and see it being a more severe disease in adults than in pediatric patients. And without a doubt, there is a lot of truth to that. At the same time, somebody who's working in a children's hospital like myself, I can tell you we have hospitalizations, ICU stays, bad outcomes, deaths of COVID-19 in this age group as well, too. So certainly for those eligible for a vaccine, they should talk to their pediatricians about pursuing one.
And what should parents know before taking their kids to get vaccinated?
So right now, COVID-19 is within the top 10 cause of childhood mortality in the country. So that's really incredible to think about. 2 years ago, there was no COVID, right? Or I guess maybe 3 years ago at this point. And now we have a new germ that's on the top 10 list. And so we have a way to prevent really terrible outcomes and childhood mortality by giving the vaccine in that school age and adolescent group. For those 0 to 5s, families really hold tight. What the FDA and what the immunization practices are trying to do is really ensure that not only is it safe, but it is an effective vaccine in those age groups. A lot of the dosing that we're using for that lower age groups is a smaller dose, which is helpful, of course, because you're dealing with smaller individuals. But we need to make sure that it still is effective. The last thing we want to do is put out a vaccine that is not helpful for this population.
Definitely. Those statistics are unbelievable. Wow. Dr. McBride, thank you for joining us this morning.
You're welcome. Thanks for having me.